Good afternoon, everyone. I'm here to talk on AI and simulation-driven Pathfinder and refractive surgery. At the onset, none of the authors have any financial interest in the subject matter of the study. Just a minute. Yeah. So prediction is certainly the future of medicine, and where prediction has found its way in every other field, why should refractive surgery be an exception to this? Currently, the decision-making in refractive surgery is essentially based upon topography-based indices as well as biomechanics, and also some amount of the risk-scoring systems play a role. But we still need parameters to predict post-operative outcomes and the strength, and to make decisions regarding whether we can operate a particular patient or not. These are a set of confusing case scenarios wherein they have different permutations of CBI, TBI, as well as the topographic parameters. And is there a way here where we can choose a right refractive surgery procedure for such case scenarios? Can we predict the outcomes of refractive surgery in these cases? To understand this, we should first know what is finite element method. So it's a numerical technique which divides a larger complex system into smaller, simpler parts called as finite elements. So it finds a wide applications in aeronautical, automotive and biomechanical industries. So we thought, why not apply this to refractive surgery as well? So we created a finite element model of the cornea, and this in combination with the topography and the biomechanics was incorporated into our application called the AIOC2022. So in order to generate a prediction model, what we need is a machine-specific ablation profile, and this in combination with the finite element model helps us to generate a forward FEM model in order to get a post-operative deformation curve which would predict the post-operative corneal stiffness. We virtually simulated 3 refractive surgeries, the LASIK, SMILE and the PRK, and the predicted stiffness which matched the post-operative patient corneal stiffness. The predictive modeling can be used to predict the outcomes of the surgery accurately. This was a previous paper wherein we have used artificial intelligence in order to pick up stable versus progressors in keratoconic eyes. And this brings us to our research question. Can we have a simple software of FEM modeling and artificial intelligence which can be used for every patient to screen and also predict the outcomes? So we incorporated tomography, biomechanics, finite FEM model of the cornea and artificial intelligence to create AIOC2022, the Pathfinder for refractive surgery. So how does it work? In order to run the data, we first import the tomography and the biomechanics in the form of a comma separated value or the CSV file, following which we choose the surgery to simulate, and the flap and the cap thickness and the optical zone needs to be entered. The patient's refraction is then entered and the add to run Q tab is then pressed. So once the report is obtained, we can export it in the form of a PDF. Now can we use the simulation tool to predict the percentage of biomechanical weakening after refractive surgery? So this is what the refractive surgery simulation report looks like. So the orange curve represents the preoperative stiffness, the green represents the predicted postoperative stiffness, and the blue bell-shaped curve tells you about the change in the stiffness. In addition to these reports, you also get the ectasia risk assessment report wherein it classifies the cornea to have either a normal stiffness postoperatively or moderate risk or high risk. So can we use the simulation tool to choose the type of refractive surgery? Definitely yes. Based upon what is the predicted postoperative corneal stiffness, we can determine which of the procedures can be a safe bet. So here is a case example wherein we see that the change after SMILE, LASIK and PRK is almost equivalent, and which shows that such corneas would tolerate either of the procedures well. So we studied a total of 1529 eyes consisting of 900 LASIK, 360 eyes with SMILE and 240 eyes with PRK. And in addition to the clinical examination, these patients also underwent a pentacam and the biomechanical data. And then the software was run after these scans were imported. And then we did the post-operative validation by a follow-up. Coming to the results, the AI built up using 1529 eyes was collected across multiple centers across the world, and it helped in successfully predicting post-operative biomechanics of 12 ectasia eyes. In addition to this, as we spoke about this earlier, it also gives you an algorithm wherein it helps you to pick up the right procedure for the patient based upon the risk that the nomogram gives. So we have known that the postoperative excessive biomechanical weakening can lead to ectasia in normal eye, and currently there is no tool to predict the postoperative outcomes. This is the first AI-based simulation software for refractive surgery in the world in order to predict the postoperative weakness, and it's also the first software to include India-specific data. This software is in beta testing phase at 20 centers across the globe. Our next step is to integrate AIOC2022 into other existing topographers as well. Thank you.
Thank you, Reshma. Now the only question remains is, what is the exact AI doing in these things?
So sir, primarily this
because do you mean to say whatever cases of post-LASIK ectasia or you have predicted earlier in those cases, those parameters or those pentacam reports or this biomechanic Corvis reports were normal, and still with the help of AI you could pick up?
So, sir, the 12 ectasia eyes that we had, these were the patients wherein we had pre-operative as well as the post-operative data. So, our longest follow-up was of 38 months, wherein we picked up that these 12 patients had ectasia. And this AIOC is primarily a simulation tool, and it secondarily uses AI. So, AI is not the primary factor in the AIOC. The primary factor is the FEM model and the simulation tool. And secondarily, the AI just helps in predicting the biomechanical stiffness after the surgery.
Okay. The same principle which Pentacam currently is using in topography,
Yes,
you
sir.
have integrated multiple parameters into it.
Yes, sir.
Thank you.